Hello guys, this is Ken, and today I would like to start a discussion about the semester of nursing school that I felt like was left out, that I wish I knew before I came into healthcare or became a nurse. I've been working in healthcare since I was like 17 years old. I've been working in healthcare a long time. I started off in housekeeping, and I eventually became a CNA, and now I'm a registered nurse currently with my BSN. Long story short, I have worked in healthcare a long time, and the one thing that I have noticed or have experienced a lot, as a nurse, that I feel like, which is one of the biggest cause of the turnover rate in nursing, is which I would call a hostile work environment or bullying. I feel like this semester of nursing school, we weren't really taught about this in nursing school. We kind of learned about all the processes and how nursing school would be, and how to take care of patients. But I feel like we really didn't learn how to take care of ourselves as nursing. And over the last few months and years, I have really came to the point that I have to be able to stay in this career field, I have to really be able to take care of myself, my mental health, my self-care, and put myself first, and sticking up for myself. Like I said, bullying in nursing, and just like I said, it's not even just bullying, it's called a hostile work environment, because sometimes it's you're not even the one being bullied, or it's just the environment. Like I said, you can be, I give an example. So you can be a new nurse going into a unit for the first time. Nobody's being mean to you, but as soon as you approach the unit, you can already hear them gossiping about other nurses. You already hear them complaining about their assignments and short staff and just all kind of stuff. And this, it's it started to chip away from you a little by little. Like I said, when I became a nurse, I was a very positive nurse. I wanted to go to work. I wanted to save the world. Like I said, I was one of those nurses that wanted to be a nurse since they were a kid. So I kind of I didn't get into nursing for money, because believe me, you don't make that much money. So, but I did want to get into nursing because I felt I had the heart, and I really cared about people, and I'm emotionally intelligent. Some people just have a lot of empathy inside of them, and I always been able to connect with people and see how they feel, and I really care. So, I thought that when I got into nursing, there were going to be other people like me, who were, really into the field to, make a difference, who really cared about other people. And when you care about other people, you really care about hurting their feelings and making them feel welcome and all that stuff. But since I became a nurse, and over the last 3 years, especially after COVID, you really see everyone's really, how can I say it? They're really frustrated. They're very burnt out. They're tired. They feel powerless, and this take a toll on everyone who work in the organization. Even the strongest personalities, after a while, people are fighting with you. They're upset. They're in a bad mood all the time. That rub off on the patients and the organization, and you can feel in organizations where people are burnt out and tired and upset, you can feel it. When you go there, you already know it's a sense, it's something's just off in this place. And like I said, a lot of nurses, after a while, they just leave. They start applying for other jobs. They start looking for different career fields, because nursing is already stressful. So why would you want to go into an environment that's going to make it more stressful? And I feel the whole bullying and hostile work environment, it starts in nursing school, because nursing school is very competitive, and you start to see your other classmates as a person who's going to take your position. because they make it out to be like only a certain amount of people are going to be able to pass, the NCLEX. So, or a certain amount of people, it's only a certain amount of people that can graduate. And you start to, look at your classmate as a competitor, like somebody who's competing for you for the position, as a graduate nurse. And that is so not true. Like I said, there's plenty of positions out here for everyone. If you go to Indeed, Glassdoor, any LinkedIn, whatever, you're gonna see that there's hundreds and thousands of positions out there in nursing. Not just bedside, but different positions, because nursing is so broad. It's such a complex field. So you can do computers, you can do home health, you can do bedside, you can do management, you can do IT, you can do work for a company like that need employee health and stuff like that. There's so many different branches of nursing. Even nurses can be a doctor. Nurses can have their doctor's degree and practice as a doctor. So there's not one way, to be a nurse. And I feel like that whole like being competitive, it's okay to be competitive, but when you're like throwing other people under the bus and making it hard for other people, that's when it goes a little too far. Like I said, there's plenty of positions in nursing, and like I said, nursing is not cut out for everybody. Just because your mom or your friend was a nurse that you think you can do it too, you have to really have it inside your heart, and you have to be really a caring person, and you have to be smart too. Nursing is very complex. You have to have the ability to critical think, and you have to be able to study a lot. Like even when you become a new nurse, you still have to study after you pass the NCLEX. When you start a new job, you might have to. And yes, I have experienced bullying as a nurse. Some of the bullying things have been direct, and some of them have been indirect. Some of the things that I experienced on the unit, which I experienced a lot, is information withholding. There are some nurses that know some stuff about a patient or information about a unit or just something, and they'll say they don't know. Not that they don't know, it's just like some nurses, that's just what they'll do. That's their form of bullying and being hostile. They will tell you they don't know something when they know it, just for you to make a mistake and, make an error. If you're that type of nurse, you do not need to be in nursing, because if another nurse make a mistake or someone in healthcare make a mistake, it's not only going to affect that nurse, it's going to affect the patient. If you know something, you need to let the person know this is not a competition. We are a team. And some nurses don't look at other nurses as their teammates, and they do not need to be in healthcare. That's not how healthcare works. We are a team. We supposed to work together. No nurse should be working by themselves or without the opinion of another nurse, because like I said, that's how nursing works. We like brush information off each other. It's called information sharing. You have to share. Nurses are not made to work alone. Nurses are not providers, physicians can work alone because they have the education and knowledge to do so, but nurses do not work alone. We have to work with other people, either with CNA, other nurses, LPN, respiratory therapy, material services, housekeeping. We work with all these different people in the hospitals. We are not working alone. Everyone else, and social workers and everything. We are all working together to be better outcomes for, patients. And that's, like I said, another form of bullying. And like I said, direct form of bullying is like someone just being mean to you. And one of the things that most nurse managers, I think, don't notice, like you can interact with a nurse for maybe another nurse for about 30 minutes, and that nurse can destroy your whole career, because during report, there have been nurses that have been so mean and nasty towards me during my career, just doing report. Like everything that we put in report is literally on the computer. So sometimes you'll be get ready to get off work, don't be in there for 14 hours, and a nurse, whatever move they in, they'll come there and like drill you about a patient, like just to make you feel like you don't know what you're doing. They'll start being short and start questioning you. Of course, if you got 8 to 10 patients, you're not going to remember everything about this patient. And it's just a summary of how the patient's day is being, and like a SBAR. It's basically the situation, background assessment, and any plans. Basically, just a simple like report. But some nurses, they'll come in whenever they're having a bad day or having something going on in their house, and they'll come there to the unit and take all their problems on the nurse before, because they feel, like I said, I feel like it's a lot of them, they feel powerless. They feel like this is the only time they feel power, when they can, bully another new nurse, or a nurse that just, don't know quite, or don't feel 100% comfortable with themselves, which no one, when you're giving a report, you're going to know everything about a patient. No one's going to know, because like I said, if you tell them everything about the patient, you'll be there all day. That's not how a nursing works. It's a 24-hour job. You're supposed to be able to report this patient off to another nurse, and they don't supposed to be giving you a hard time. So, and that's a notice, most of the bullying that I noticed happening during report time. That little 30-minute report, the nurse comes in hostile and ready to try to, get you in trouble. You have some nurses looking in behind other nurses' charts to see what they did, to make sure they made a mistake. They won't even tell the nurse that they made a mistake or they did something wrong. They'll go behind that nurse's back, tell someone else, or talk about the nurse and try to get that nurse in trouble. And another situation I feel like, and that leads to burnout in nursing, is like not feeling safe. You don't feel safe on who to call, who to talk to. Would this person look out for you in a situation? And this happens a lot in most facilities I work in. Like, you'd be afraid to go talk to someone, or, because you're afraid of what they're going to think or say, because they're going to talk behind your back. And you still have questions. Like I told you, nursing is a team sport. Like, we all are going to have questions. If anyone knows everything in nursing, please raise your hand for me, because I need to, pick your brain, because I don't never met anyone who knows everything, because it's just too complex. You will be in training for the rest of your life, because there's always something new to learn. There's always a change in processes and policies. So that's my take on, in bullying and nursing. And I think, like, if, people, change this mentality about nursing, or, make it such a less toxic and stressful job, a lot of people would stay. Because I feel like I have left a lot of jobs because of other nurses. I didn't leave the job because of the patients or anything. I left it because of other nurses. It's like, you just don't want to work with certain type of nurses. You already know what type of personalities you're going to be working